Good morning, everyone. Thanks for coming. Really appreciate everyone showing up today. It's a neat time, and getting a group like this together isn't easy, so we appreciate you showing up today. I'm Tony Remington. I'm the CEO of Diagnostics. Before COVID, we were a small lab, 2 blocks up the street at 632 Russell Street, providing laboratory services for across the United States. When COVID-19 hit, outside of the United States, our PhD science team, kind of got on it and asked our leadership team if we should validate that virus. So we went ahead and did that. So we were already doing that type of testing, so we were prepared for, we had a team in place to do the COVID-19 testing. So tribute to our scientists that kind of got ahead of this. And then when it came to the United States, kind of a gravity way, we're about compliance and helping those most in need and supporting the local community. And so we were really careful where we allocated our capacity. So in the beginning, we partnered with St. Elizabeth's Healthcare and Tri-Health and Christ to do their local kind of ICU staffing around time patients and nursing home type situations. And that led to a partnership with the state of Kentucky where we had capacity. We just kind of went for it. We hired a bunch of people, blew out a wall. Lee over at Triad was kind enough to leave the space so we could expand. We were sharing space with them. So we picked up more space. Since then, we've hired about 100 people in Covington. We basically filled our existing space, which is 2 blocks away. And during the relationship with the state of Kentucky, I want to really make sure I emphasize this. The federal government was amazing from day one, and just kind of we have a good relationship with Senator McConnell's office, and we were able to kind of talk to them about our needs. You all probably know there's limited supply of swabs or gloves or gowns and things like that. So what I was really impressed with is kind of collaboration where everyone came together, industry, private, public sector, to really focus on the patient. So that's how this all started for us 3 months ago. That led to helping those most in need in Kentucky. As you all probably know, we've been helping out with nursing homes and the prisons and the hospitals, and been in constant contact with Senator McConnell's office and local officials as well. I also have to mention that CTI, Tim Schiller, is here somewhere today. They're a CRO up the street. They do clinical research. We needed gloves. We go to 10, much bigger company, been around a lot longer. They were there to help us along the way, so I want to recognize him. But at the end of the day, why we're all here today is during all this, Kroger Health, which is the most amazing company in this area, everyone knows their history. Another company focused on putting the patient first, doing right by the community. They set up these drive-thrus to really help people at a loss to them, multi-million-dollar loss, just kind of doing the right thing. We got connected with Kroger about helping them because they were doing drive-thrus outside of Kentucky that had really bad turnaround time. And we said, look, we want to stay in our lane, we want to support Kentucky, we need to focus on the state needs in Kentucky, but we'll help you one at a time, one drive-thru at a time. And then what ended up happening is we started doing drive-thrus in Kentucky with Kroger, and that's really when this took off with our relationship with Kroger. And they came to us one day and said, how do we do more testing? How do we get telemedicine testing done in the home? We see symptomatic people that you don't want to have to leave their house to be tested. And literally, we're 2 blocks away. You're all welcome to come by anytime. And I said, we'll build a lab for you if you want to help us fund it. And they were like, let's do it. And so that literally was probably 8 weeks ago. And we just put our head down and bought $2 million worth of instrumentation and blew out walls. And as you can see here, this lab will be done probably in a week or so. And that partnership is kind of what led to this building and the reason we're all here today. And so now with Kroger Health and Gravity, we're able to do video telemedicine. We can have a patient at home if they're symptomatic. We're able to do on-site testing for employers, universities, sports teams that need that, or we can set up a drive-thru like they did nationally. So it's really important for everyone to know. Kroger did 130,000 samples nationally at these drive-thrus, and I think it was in 18 states. And that was all funded by the federal government. So those drive-thrus wouldn't have existed without what Senator McConnell and the other folks have done to support all this testing. So to us, it's just been a really amazing, we're humble, we're literally 35 people in Covington, we're up over 100 now. We're hiring 50 more people right now. Been amazing, the talent in this area has been amazing. We've hired a ton of great science grads and all that. So, for me, this was kind of a, hey, let's do it. Let's let Senator McConnell see what we put together here today. So last thing I wanted to say is thank you so much everyone at Gravity. The employees are amazing, working 7 days a week. They all have families. They put that aside and what's best for the community. Just the effort that everyone put into, I think we've done over 275,000 samples now. We're doing about 6,000 samples a day, 6 days a week. We're open on Saturday. We anticipate that volume going up, unfortunately, so we're building that to be able to do 20,000 samples a day, 6 days a week. So thank you to the team, thank you to the employees, thank you to Kroger Health for believing in us and giving us a chance to earn your trust and respect. And thank you to Senator McConnell for all the work you're doing to support us here in Kentucky and helping to keep this state and the area safe. So without any further comments, I'm going to introduce Rodney. I'm sure everyone, I didn't even know you guys were. I'm sure everyone knows Rodney McConnell's the CEO at Kroger Health. Grew up in Kentucky, been at Kroger a long time, been someone that I've admired from afar. There's no one in this area that doesn't value what Kroger does for the community and for consumers and customers across the country. And we've been talking to Kroger for a long time about ways we could help them. This really came together and was a chance for us to do good work together. So thank you, Senator McConnell, for taking the time to come today, and I'll let Rodney have some more comments.
Thanks, Tony, and thanks for the kind words as well. And it's a real honor to represent Kroger. To me, if you look at over the last several weeks, our associates have just taken it to a different level, and it's just so proud of everything that everyone's doing on keeping affordable, fresh food available to everybody. We've also been able to hire over 100,000 associates from other industries that have had more difficult situations. And it's incredible to be able to hire people that start out talented and being able to convince them to come to Kroger, and then hopefully they'll make a career out of it. Leader McConnell, thank you for all that you do for our country and for the state of Kentucky. It's just, to me, impeccable, impressive, and appreciated every day. Tony talked a little bit about Kroger Health. If you look several weeks ago, we committed to doing 100,000 tests. We are now close to 130,000 tests. We originally committed to 12 states. Now we've tested in 19 states. And one of the things that you learn really quickly in any type of really tough situation, if you look at the pandemic, is that it takes incredible partnerships to make anything work. And it's partnerships with people that traditionally you may not even have partnerships with. If you look at, Tony talked about the relationship on Gravity and stuff. It's just been amazing. One of the things that's so appreciated with the Gravity relationship is we're able to test people and turn it around in 24 to 48 hours. And when you think about that, one of the things, if somebody's unfortunate to have the symptoms, you want to be able to get that back result quickly to them so they, I'd say, get out of circulation, but not giving it to others. And that partnership is just incredible. The partnership at the federal level, at the state level, here in Kentucky, we've tested over 55,000 people, and the relationship with the governor, with Gravity, with HHS, with the federal government, with local health associations. It's just all of those things together. And the other thing that you see the best in people, if you look at the testing that we are doing, we have over 100 of our associates that volunteer their time to it. And you just hear time and time again where people just do things, and when you compliment them on them, they just say, well, I'm doing it because I can be helpful for others, and that's what my parents taught me to do. And it's just, to me, it brings the best of all of us. And as a country, we will get through this. If you look at over history, time and time again, the U.S. has had many, many things that's been as hard or as bad as this. And every time we come out stronger because we come together as one. And if you look at the motto of Kentucky, united we stand, divided we fall. And to me, this is a great example where together we will come out of this better. And I can't think of a better person leading the Senate in today's world than Senator McConnell. I mean, he is an amazing human being that has an amazing worldview and incredible loyalty to the United States, and has done things years and years and years of making this country a better country and working with everybody in Washington. Sir, you have a job that I would not want, but hats off to you, and we appreciate it. And when you're in Kentucky, the man doesn't need an introduction. All I can do is say thank you, and we appreciate everything you're doing for our state and our country every day. And I'll turn it over to you, Senator.
Well, thank you very much, Rodney, for the overly kind remarks and for keeping us all fed during all of this. And Tony, we're here obviously to highlight this remarkable company, wherever you are, this remarkable company, which is an important part of this overall effort. But let me start by just taking you back to the beginning of the year, if you were in my job. We started off with an impeachment about the most partisan thing you could imagine. And as soon as that was over, the pandemic hit. Remember, we knew little or nothing about this disease. What do you do when confronted with something that healthcare professionals are telling you requires sending everybody home and shutting down the economy? So on the economic side, we went from having the best economy in 50 years in February to a depression level situation a few months later, intentionally, in order to confront the healthcare challenge. So every bill has to start somewhere. And so the CARES Act, which is the core and the largest of several pieces of legislation that we approved back in March, sought to tackle both the healthcare pandemic and the economic collapse together. So, in about a week, we, in my office, in consultation with the administration and Senate Democrats, put together this bill that, under any other circumstances, believe me, we would not have passed. Because the practical effect of what we've done over the last month is to now have the United States debt the size of our economy for the first time since World War II. That is not lightly done. So after we passed the CARES Act, I thought the smart thing to do was to take a look, push the pause button, let's see how what we have done is working. See what happens when the economy begins to open up again. And take another look at it in July. We're now in July. And see, based on the conditions in July, not March, what seems to be appropriate if we do another rescue package. So I'll get to that in a moment. But we're here today to highlight a part of this overall effort, testing. The three things we obviously need to have on the healthcare side, if we're ever going to get past this, is testing, treatment, and vaccine. It's clear the coronavirus is not over. Some of you know I am a strong advocate for wearing a mask, and I see that all of you are doing that. And you should, because until the coronavirus vaccine is found, the single best thing we can do to protect ourselves and others is not complicated. It's a mask. And also social distancing, which comes in conjunction with that. So, for myself, whatever audience I have, this is what I preach every day. And I not only preach it, not only preach it, we practice it. The Senate went back in session on May the 1st, and we've been in continuously except for a few weeks off in recess like this one. We've been wearing masks, we've been socially distancing, and we've been able to do it safely. And the only way to operate safely until we have a vaccine is to do this. least some audience, need to be continually reminding everybody of our own personal responsibility to do this. Now back to the CARES Act for a minute. It's so multifaceted. And the reason I have some notes in my hand here, so multifaceted that it really kind of underscores the comprehensive nature of what we were trying to do here, which was not only tackle the healthcare side, but the economic side in a massive way to literally prop things up until we could somehow achieve normalcy. So gravity is a perfect example. That's the reason I'm here today, not only because you guys built a great business even before this, but with this, even better. Here's the various things that they were able to take advantage of. They have a $24 billion contract with the Commonwealth to perform 300,000 tests. That $24 billion came from the CARES Act, down to the state and over to these guys. Also, they accessed another fund, a provider fund. Gravity got $105,000 out of that, and that was over on the healthcare provider side. And then the popular PPP loan program, which I think almost everybody's familiar with now. 47,000 Kentucky businesses have access to these PPP loans. $5.2 billion came into Kentucky and has been lent out so far. And the word lend doesn't really make sense because if you follow the criteria, it's a forgivable loan. And the idea was to keep people employed doing it. So Gravity took advantage of that as well. And so they're a good example of a company that smartly accessed several different avenues to get through this. And we're quickly adapting to something we obviously needed, which was testing. So the question I always get before taking whatever questions these folks may have is where do we go from here? I think there's a high likelihood there'll be one final rescue package. We've already begun to discuss that, and I've begun to lay out what you might expect. Let me tell you what it is not going to be. It's not going to be a $3 trillion left-wing wish list that the House of Representatives passed a couple of weeks ago, which bears little or no relationship to reality. That would have doubled, had that passed, that would have doubled the debt that we already had. That would have gone to a debt that would be twice gross domestic product. That's not going to be enough. Let me tell you what will be in it for sure. Liability protection. Liability protection for everyone. This is not just for businesses. This is for hospitals, doctors, nurses, businesses, universities, colleges, K through 12 education, local government, everybody who had to deal with the coronavirus, unless you were grossly negligent or engaged in intentional misconduct. We're not going to subject you to an epidemic of lawsuits on the heels of the healthcare pandemic that we're already having to deal with. We're not going to rewrite the state tort law of every state in America. This will be narrowly crafted, dealing only with the coronavirus, kicking in December of 2019 and going for about 4 years. Number two, if you're looking for a theme of the next package, think kids in school, jobs, and healthcare. We can't have a normal country if we don't have kids in school. America cannot get back to any semblance of normalcy if kids are not back in school, K-12 and college as well. And that's going to require significant assistance from us because these schools are going to have to adapt to new working situations with shifts, masks, and other things adjust to working smart during this pandemic until we get a vaccine. Now, kids and jobs are connected with each other because you can't have a functioning job situation unless you have kids at school. And of course, there's still healthcare needs to be done. People who made $40,000 and less got hit particularly hard because many of those folks work for restaurants, hotels, and hospitality field. We're certainly open to additional cash assistance to them as we provided before. So that gives you sort of a general outline of what you might expect, and this is likely, almost certainly going to come together in July. So that gives you a snapshot of what you might expect in the future, and with that, I'll be happy to throw it open for whatever you might want to ask.
So you're saying, Senator, that it's not going. You're saying, Senator, that it's not going to be a $3 trillion bailout. What kind of money are you thinking it might be?
Well, I'm not going to announce that today, but I do think the environment's different now than it was in March. We were able to pull everybody together as CARES Act and other bills closely related to that without a single dissenting vote. This is now July. It's that much closer to the election. I think this is probably going to be more difficult politically to pull everybody together than it was. And so I'm not going to give you a top line. I can just say that the top line won't be anywhere close to what the House did.
Senator, how do you reconcile the fact that you're sitting in a place that is obviously a proponent of testing, and the president you support is saying we're doing too much testing?
Well, on this issue and other issues, I speak for myself, and adequate testing is extremely important. We clearly are having a surge in some states. There's even been an uptick the last couple of days in Kentucky. I think we're all aware of the facts here. This is not over. It's not anywhere near over. And so we have to work smart by wearing our masks and testing as widespread as we can achieve is a big part of getting through this.
Do you agree with the president in terms of withholding federal funds if kids don't go back to school?
I'm sorry, what you said?
The president's talking about withholding federal funds if we don't, from those entities that don't get kids back in school.
Well, what I think ought to be done is, and I already alluded to it, is we need to understand that for the schools to reopen, they're going to need a lot of assistance. They're not going to have the resources to do that. So I think it's our job to come up with the right figure to make available for education, to make it possible for them to meet, for example, the CDC guidelines, which are kind of evolving, but nevertheless, I think we ought to take advice. My approach to this whole thing is let's listen to the people who really know the subject. Dr. Fauci, Dr. Birx, Center for Disease Control, and that's the way I approach these issues.
That sounds almost like the exact opposite of what the president's suggesting. You're talking about maybe spending more money at schools. He's talking about maybe taking some of that money away.
All I can do is tell you what I think.
Senator, with the uptick in cases in certain states like Florida, do you think you'll be attending the convention there?
You plan to attend the convention in Florida?
In Jacksonville.
Well, I think the convention is a challenging situation, and a number of my colleagues have announced that they're not going to attend, and we'll have to wait and see how things look in late August to determine whether or not you can safely convene that many people.
Senator McConnell, some Kentucky businesses have received larger PPE loans and some have received small ones. There's a lot of people struggling. What would you say to them?
Well, I think the first thing I would say is if you've lost your job, it doesn't make any difference whether your company is this big or this big, you still lost your job. And the PPP loan program has been overwhelmingly successful. Have there been some mistakes? I think there certainly are. When you spend that kind of money quickly, there are going to be mistakes made. But overwhelmingly, if you look at the way the economy seems to be coming back, you can thank the PPP loan program for that because it pumped an enormous amount of money into the economy. And you can argue over whether this particular company or that particular company should or shouldn't have gotten it. They obviously met some criteria to get it. And if I'm unemployed, honestly, I don't care whether my employer is this big or this big. I lost my job. And so I think by any objective standard, the PPP loan program has been a huge success.
Will there be another stimulus check for Americans in the second COVID bill?
Will there be a check directly to Americans in the second, in the next?
Direct check?
Direct checks.
Well, we're open to that. We did it in the first round. As I indicated, the people who've been hit the hardest are people making $40,000 or less who are largely, not all, but largely in the hospitality business, hotels, restaurants, that sort of thing. And I think the cash that we provided directly was important for them, and that's certainly something we're considering. Okay, thanks everybody.